Medicare and Medicare eligibility. First of all, Medicare is provided through the Social Security Administration. It is for people 65 and older. It's for anyone, any age, who is in end-stage renal failure, basically kidney failure. Renal means kidney failure, so that's any age. And then persons who have been receiving Social Security disability benefits for 2 years. They would also be allowed, regardless of age, to take advantage of Medicare. Medicare is your medical benefits for senior citizens, basically. There's 4 parts. Medicare has parts. Part A is hospital insurance. Part B is medical insurance, doctors, lab work, that kind of thing. Part C is called Medicare Advantage. It's kind of a unique plan. I'll tell you about that in a moment. And then D is easy. Part D, it's the newest member of Medicare, and it's the prescription drug program. D for drugs. It'll help you remember. Medicare Part A and B have distinct enrollment periods, depending upon the situation. So first of all, the initial enrollment period, when you first become eligible for signing up for Medicare, Part A and Part B, you can do it as early as 3 months before you turn 65 or as long as 3 months after your 65th birthday. So that's your initial time. You want to sign up during this time if you can, because if you don't, the premiums going forward that you would pay on Part B, because Part A is free, or basically you've already paid your money into Social Security for a number of years, but there is no premium for A, but B has that premium. If you don't take it when you're first eligible, when you then end up taking it, your premium is going to be higher for the rest of your life because you didn't take it when you should have. So be aware of that. There's a general enrollment period every year for Medicare, and it is January 1st through March 31st of each year. We're coming up to this very busy time of year for people who handle these kinds of programs. There's also a special enrollment period. For example, if you were covered by your employer because you were actively employed and you just waited to join later, you could, anytime you leave the employer, then you could, you sign up. During the 8 months following an employer plan termination, let's say you were covered at work, you are age 65, and then they terminate their plans, you could then, up to 8 months later from that termination of the plan, sign up for Medicare. And then if you become, you're disabled and you are working, you could utilize the special enrollment period in that situation. Medicare Part A and B, like any other kind of insurance, does have exclusions to the various sections. For example, A and B exclusions. Eye exams are never covered, and the related prescription glasses, not covered through Medicare. Most dental care, including dentures, is not covered. Sounds like a gap in coverage, doesn't it? Cosmetic elective surgery, never covered. Never. That's key. Cosmetic elective. It means you're doing it just because you want to, not because it's medically necessary. Acupuncture, not covered. Hearing aids and exams for fitting of hearing aids, not covered. Orthopedic shoes, not covered. Long-term care. Long-term custodial care in a nursing home is not covered through Medicare. People get confused on this point because you can get up to 100 days of coverage in a nursing home, but you're there for rehabilitative reasons only, and you had to be in the hospital for at least 3 days before you go into the nursing home. For example, grandma falls and breaks her hip, goes into the hospital, has surgery to have the hip repaired. She heals up to a point in the hospital. She's been there at least 3 days. Then she could go into a nursing home, into a rehabilitative wing, or they sometimes refer to it as a step-down unit, and she would finish recovering and rehab, learn to walk with that repaired hip, maybe learn how to use a walker or a cane or whatever she needs to do. But then once she's recovered, she goes home. She does not go into that nursing home knowing she's never coming out. She's not there for 24-hour round-the-clock custodial care. It's rehabilitative only, and that's all that Medicare covers. And then also the concierge, the special care, kind of like contracted coverage that you can purchase, not covered through Medicare A or B. Part C of Medicare is called Medicare Advantage. It's very unique. It is the old Medicare Plus Choice is what it used to be called. And then they changed the name to Medicare Advantage. It is care, health care that is offered through HMOs or PPOs. Basically, the government contracts with HMOs and PPOs to provide coverage in certain geographic areas of the country. All of the services covered under the original Medicare, except hospice care and some care in qualifying medical research programs, are covered. It can also offer extra coverages. Some of these HMOs, PPOs might cover hearing, might cover vision, dental, wellness programs. You can see that you might be able to get better benefits if you're able to take advantage of this. It's going to depend. Beneficiaries must be enrolled in Medicare Part A and B. So you have to be enrolled in A and B before you qualify to take advantage of Part C. Special needs plans, specialized health care for certain groups of individuals who have certain physical or mental handicap needs could be met through these plans as well. It can be a great thing if you live in the proper geographic area. Typically, they're found almost all the time in the large metropolitan areas. It might be a little more difficult if you live in a more rural area, but it's worth checking into in your state to see what might be available. Part D, again, D stands for drugs. It's the prescription drug program. It's the newest member of the Medicare coverage. It came out in the early 2000s. It's optional coverage. It's provided through private insurers. So you do not have to take it. It is totally optional. Beneficiaries, people who are enrolled in Part A or in Part A and B, are eligible if they choose to take advantage of it. They can have it as a standalone program or it can be integrated with other plans. Understand that, it is an optional program. It is insurance. There is a premium, and you have deductibles that have to be met on the Part D. Again, D is for drugs. It can be a huge savings for the elderly. You don't want them to be scrimping on their drugs. They need to take what they need to take to stay as well as they can.